Housekeeping notes. Our speaker will give her lecture for approximately 45 to 55 minutes, and afterward we'll have a short time of Q&A. If you haven't done so already, please make sure to sign in using one of the QR codes in the back at your earliest opportunity, especially if you are a student looking for extra credit, so that we can be sure to have an accurate head count. For those working on the REACH badge, please be sure to check in with Dr. Hannah Ragusa to get your attendance certificate. There are also refreshments available in the back. Please don't be shy. Finally, if you'd like to support the continued work of the bioethics lectures through spiritual and/or financial support, I would be happy to speak to you at your convenience. Friends, it is my great honor to introduce Dr. Margaret Chisolm as our esteemed lecturer this evening. Dr. Chisolm is Professor of Psychology and Behavioral Science at Johns Hopkins University. Board certified in general psychiatry, she has 3 decades of clinical experience, has served as PI or as co-investigator on multiple nationally funded research projects, and has authored over 150 scientific, clinical, and medical education papers and book chapters on psychiatric disorders and humanistic medical practice. In addition, she has published 2 textbooks and an award-winning book for patients and families living with mental illness, From Survive to Thrive, Living Your Best Life with Mental Illness. Dr. Chisolm is a member of the Miller-Coulson Academy of Clinical Excellence and the director of the Paul McHugh Program for Human Flourishing, where she uses the arts and humanities to explore the big questions. What does it mean to be human? To be a physician? To lead a good life for both doctors and patients with medical learners? Indeed, it is precisely on these last topics, namely that of flourishing for both healthcare professionals and patients, which Dr. Chisolm will be addressing us in her lectures tonight. And so, without much further ado, it is my joy to welcome Dr. Margaret Chisolm, who will be speaking on flourishing in healthcare education and practice.
Thank you.
I don't know that one works for the...
Okay.
That's just for the...
Okay, thanks. I am so excited to be here. Thank you so much, Christopher, for inviting me. I'm not on presenter view, though, so I can do this without notes, but it always helps because I go astray.
Here we are.
We did practice this. I'm going to go ahead and get started and just tell you what I'm going to be doing. I'm going to, there's a lot of objectives, but the main objective is for you to experience an arts-based activity and, oh good, we got it. Experience an arts-based activity and hear a little bit about how this fits into the context of higher education, integration of the arts and humanities, and we'll also talk about its relevance to museum-based, the relevance of museum-based teaching to flourishing in healthcare, education, and practice. I'll tell you a little bit about what we're doing at Johns Hopkins, and then we'll have time for you to reflect on the ways that you might integrate these into your own teaching or learning. So it's going to be very interactive. There's just going to be a little bit of didactic here and there, and hopefully we'll have lots of time to speak with one another. So over the past few decades, there's been an impressive accumulation of evidence indicating that the arts and humanities are indeed important in health professions education across the continuum of training, all the way from pre-med or pre-health professions education to continuing education. And the National Academy of Sciences, Engineering, and Medicine has issued this report in 2018 that concluded the evidence is sufficient to urge the support and evaluation of courses and programs that integrate the arts and humanities with medicine and higher education. Similarly, a large initiative by the World Health Organization on the arts and health in 2019 concluded that future policy should support the inclusion of arts and humanities education within the training of healthcare professionals to improve clinical, personal, and communication skills. I would say communication skills are clinical skills, but I'm not the World Health Organization. In recent years, the Association of American Medical Colleges has identified the arts and humanities as a core area of focus. They commissioned a large scoping review in addition to other projects exploring the arts and humanities in medical education, and concluded from their evidence that these are essential in medical education to improve health outcomes for patients and communities and for preparing trainees for the unique challenges of the 21st century. They made a series of recommendations focusing on this topic, including more robust evaluation of the programming, enhanced collaboration with learners, educators, and interdisciplinary experts, and faculty development. So they commissioned a scoping review that looked at over 800 articles describing arts and humanities in medical education, and that led to an emerging theory of practice that describes the 4 core functions of the arts and humanities in medical education. The model's 4 functions are lenses that help focus one's approach to teaching, and you can see that's skill mastery, perspective taking, personal insight, and social advocacy. So these are the roles that arts and humanities can play in education. The scoping review also identified the existing landscape of arts and humanities offerings. They're mainly occurring at the medical student level. There's great variety in content covered. The largest representation was literary arts. There's less focus on visual arts-based approaches and visual thinking strategies, which is what we're going to experience together today. But this is a real opportunity for expansion. So with that, I'm going to dive into this interactive experience. So visual thinking strategies, has anyone participated in a discussion like this before? Okay. So visual thinking strategies was developed by Philip Yenawine and Abigail Coulson. So Philip Yenawine was the head of museum education at the Museum of Modern Art in New York, and Abigail Coulson was a cognitive psychologist who studied aesthetic development. And the head of the museum asked Philip, does anybody learn anything when they come to your sessions? They always have a good time, they enjoy looking at the art, but do they retain anything? Does anything happen? Is there any impact? And so they studied the people that came and said, no, actually, they don't retain anything, they don't learn anything. And so they started looking at studying the way people looked at art and developed a method that would actually increase the impact of their education and lead to skills that would be not only useful in the museum, but would transfer to other parts of their life. If they were students, they might, these skills might show up in science class or math class. If they were professionals, they might show up in their work life. So it's a very structured teaching method that encourages open discussions of visual art, and it's based on their observations that 80% of people who look at art are mainly curious about the story that the art is telling. And so they developed this method, they studied it, they refined it over 30 years. It's been used with all levels of learners from pre-K to adult learners, and in the last 15 to 20 years it's been used increasingly with health professions learners. So just to put you at ease, you don't need to know anything about art. No art history is needed, no art knowledge, just your own perspectives and experiences, that's all we're asking. There are no right or wrong answers, Everyone's going to be invited to participate, but I'm not going to call on anyone, and no one's obligated to actively participate. If you want to join in the conversation, you'll raise your hand, and then I don't know if we have another mic that we can bring around so that everybody can hear, but you can respond to the questions I ask, and then we'll call on the next person. I just want to remind people that struggle and discomfort happen when we learn. So art is designed to be emotionally evocative, and we want everybody to feel like they're having a good use of their time by being here. And if something's really distressing, obviously there's no need to stay, but I can't predict what's going to evoke certain emotions for people. I had a student actually weep at a still life with grapes. So I don't, I just want, if there are some uncomfortable emotions, just try to stick with it if you can, because that is a place where we're learning. Then you're going to leave with more questions than answers. You should really expect and accept non-closure. I will say that when we do this in the museum, we do it in classrooms, we can do it online, but we often do this in the museum. In the museum, I ask the students not to read the little plaque that's next to the art. This is really supposed to be, you're supposed to be responding to the image, to the visual stimulus, not the reading what's written about the work of art. I did this yesterday with a group, and somebody did a reverse Google image search of the art that I showed, and that's kind of like reading the plaque. So I'm now saying, please don't reverse it, Google image until after our discussion. And with that, we'll just dive right in. So we begin each of these sessions with looking independently, silently, for a moment at a work of art. So just take a moment to look at this piece. Would it help to dim the lights a little bit? Tell me when you fall asleep. Oops. Okay. So the first question is, what's going on in this picture? Anybody want to take a guess? What's going on in this picture?
I think she is making some type of clothing.
Okay, so you're drawing our attention to this figure you refer to as a she, and you're wondering what activity this person's involved in, and you're thinking that they're making some type of clothing. What do you see that makes you say that?
Let's see. The way her hands are positioned in her lap, and I can see the garment on the table with scissors and thread, and it looks like a pin holder behind the thread.
Okay, so you're noticing the position of this figure's hands. It looks like they're working on a task with their hands. And there's fabric here, there's fabric up here. You're also noticing other things that you associate with sewing, scissors, some thread, maybe even a pin cushion. Great. What more can we find?
My first thought is that she looks reflective to me. She looks like an older woman who has maybe set down the sewing for a moment to, maybe it brings forth a memory from her past, something that the fabric reminds her of, the task reminds her of. It's almost like she's looking into the distance and thinking about, you know, what this means to her, what this activity of this garment, sewing this garment, means to her from maybe her previous life experience.
Okay, so for you, you agree with what's been said that she might be involved in this task and that this is a she, but you're thinking that the task, she might not be like sewing at this moment, that there might be a pause in the action and that she is thinking about something, a memory perhaps that's been triggered by this activity, but there's something for you that makes you say that she looks reflective, looking like she's lost in thought. What do you see that makes you say that?
The direction of her eyes, that she's kind of not, it's almost like she doesn't look to me like she's really focused on something right here in her lap, but maybe into the distance, that she looks very still to me, which says my thoughts are going. It's her face that I'm attracted to first.
So there's something about the expression on the face, but also the posture and the gaze, and there's the way she's sitting just looks very still to you, or the way she's depicted, and then there's this gaze that's downward, maybe a far off kind of look. Great. What more can we find?
My first thought was that she was praying, because due to her eyes, like the woman before I said, she's looking down, and then she's distracted from her task. Like she's not participating in her task anymore. And it is almost like maybe a memory came a hold of her and she just wanted to pray. And when I thought of that, I saw the cross in the back, and that's why I immediately thought that she was praying.
So you're agreeing with the idea that she's been involved in a task. It seems like there's a little consensus building there, but you're also noticing that she, maybe for you, maybe not sort of, maybe there's a memory that provoked this moment of reflection, but for you the reflection is more specific, and takes the form of a prayer. And one of the things that made you think about that was noticing that there's this cross in the background. And so thinking that she's paused in the task, is in a moment of reflection, and in fact, it may be praying. Great. What more can we find?
Oh, I kind of noticed she has like a passive way, like body language, kind of like similar to Jesus on the cross, and like the way her head like kind of pointed down, kind of looks similar really to the way his head's hanging down. And she's just very relaxed looking, just sitting back and passive.
So you're also drawing our attention to the cross, and you're thinking that there's some echoing of the posture, and especially with the head tilt of Christ on the cross and this woman, that there's some passivity, there's some relaxation of muscles maybe. Great. What more can we find? Thank you.
I was wondering whose house she's at, because there's the picture of the white woman on the wall, and to me the lady looked really tired, so I don't know if it was like a long day of work and she was seamstress or something, and I don't know, to me she looks really tired.
So you're raising a question about the setting here and thinking, where is this? Is this somebody's home that's not hers? You notice that this portrait here on the wall for you looks like it might be a portrait of a white woman, and then you're thinking maybe this person is working in the house, working on a task, seamstress, and wondering about maybe the relationship between these two people. Great. What more can we find?
I'm just drawn to the picture of the woman also, and that it's not her, the whole picture. To me, that means, I'm not sure what it means, but it seems like it would be some significance. And the first thing that I thought of was the picture and the crucifix has some kind of meaning to it, you know.
So you're also looking at this, that was suggested earlier, that this might be a white woman, a portrait here, but you're noticing the composition and how this portrait that looks like it might be oval or something is cut off here. And so we don't see the whole image, and you're wondering what the significance might be, what the artist might have intended by that. And then you're wondering, given that there's also this other there's a cross hanging here, another object hanging on the wall, and wondering if there's some relationship between those two items, just like we were thinking about what the relationship of this figure here and the depicted figure here is. Great. What more can we find?
It looks like she's got some sort of brooch or something linking the scarf that might have seemingly Jesus' face on there. I'm a little far in the back.
You can come up and look more closely, but you're noticing that there's a brooch, and it looks like maybe a cameo or something that has or a little mini portrait in the brooch, and you're wondering if it's Jesus that's depicted there. What more can we find?
I imagine that this is old Nanny and the picture.
Brooch and the portrait are the same person, and she was raising a child, then she get married, and she stays in her home, and the girl and right now the young woman are gone, and she's praying, maybe angel or something, and this is why she's just kind of very peaceful. I think it's peaceful and reminiscing. This is my opinion.
Okay, so it's been suggested there's a portrait of somebody on this brooch, and you're seeing that this portrait looks like it's depicting on the brooch the same individual that's depicted here. And you're putting together a story thinking that perhaps this person that she's wearing an image of on her brooch is somebody that she raised as a little girl. And now that little girl is also depicted here, has left home. She's left here in this home and is remembering, maybe even praying, but remembering the memories of that relationship. Did I get that right? Great. What more can we find?
At first I thought like the white on her lap was part of the sewing project that she may be working on that we were kind of getting an idea of, but I noticed that that white carries up to her chest, so maybe she's wearing some sort of like apron or something like that, which would help with the idea that maybe she was raising someone.
Okay, so when you first started looking, you were thinking that white fabric that's on her lap might have been some part of the sewing project, but then as you look more closely, you're noticing that it kind of carries up here, and so you're thinking, well, maybe that's sort of an apron or some kind of uniform that would go along with this idea that she's working there in the household. Great. What more can we find? We have time for two more, so I'm going to give you two.
Well, my eyes are drawn to the center of the portrait, the glass, which appears to be empty. reflecting maybe that she's poured out, that she's spent her life.
Okay, so you're drawing our attention to some of the other objects. We talked about some of the sewing objects there, but you're noticing there's this glass. And looking more closely at it for you, it looks like the glass is empty. And then you're kind of thinking metaphorically about what that might symbolize, and thinking maybe it symbolizes what we've been talking about, this person maybe in a reflective time, thinking about memories from the past, and thinking that this person might have been a worker in this household, and thinking that she has been emptied too. She's drained in a way of energy, spent. Great. What more can we find?
So my eyes were drawn to the date, 1924, very small in the bottom corner. So between World War I and World War II. And I was wondering if the picture is depicting the present at 1924 or the past. Maybe with the gas lamps before 1924.
So we talked a little bit about the physical setting, thinking that this could be a house and wondering whose house it was or is. But you're noticing something down here that to you looks like a date, suggesting like maybe it was painted in the 20s, and maybe is this depicting a contemporary scene at the time of the artist created this? And if so, when, trying to situate this in time, and one of the clues for you that it might be 1920s or earlier is this lamp here that looks like some kind of kerosene or gas lit lamp. Great. I'm going to have to stop us just because there's more to say, but this is astounding. I have used this as a prompt for visual thinking strategies several times, and I heard new ideas tonight that I had never heard, and it was really fascinating. Thank you so much for participating in that. That is by Walter Motley, and it's called Mending Socks. But I want to kind of pivot from the content of that and go to the process and ask you to reflect and share, and I can bring the mic around. I'm getting my steps in, it's great. What does visual thinking strategies ask of you? What did that process require you to do? So think about that. You might also want to reflect on what I, the facilitator, did to support the discussion, and then we can talk a little bit about how it's relevant to flourishing, if at all. So what did this ask of you? What? Yes? I like moving.
The first thing I thought of was like definitely not what everybody else was thinking. So I think that it's big, like collaboration. Like whenever somebody else was saying something, I was like, oh, that makes so much sense, and then it like completely shifted my idea on like what the picture was, what kind of story the picture was telling. So I thought that was cool. Like literally every time somebody said something, it like brought up a new idea. So I think that collaboration is something that this could ask of people who are just like trying to figure out what's going on.
So it asks you to listen to what other people were saying, to kind of consider their ideas, to kind of appreciate their perspectives. And for you, you noticed that you were hearing some ideas that you hadn't heard before that caused you maybe to revise your own ideas based on what you were hearing. And there's a sense of like teamwork, that together you could see more than you could individually. Great.
I feel like it kind of caused you to like, because you couldn't see anything about the picture, so it made you kind of have to go into yourself and reflect on yourself a little bit as to like what you think is going on.
Yeah, you weren't really told anything about it, so you were kind of having to use your own kind of critical faculties, your observation, your kind of reflection, listening to other people to try to make sense of it. So you really were tasked with meaning making, and you had to persevere at that. Great. Somebody over here. There we go.
I like how it's kind of started live. Like it seems the first kind of people that raised their hands spoke more broadly about kind of the broader subject of what was going on, whether that was working or praying, but then it got like more and more zoomed in on focus on details of the brooch and the glass of water. And I almost felt like we could keep going.
Okay. Yeah, we could definitely keep going, but the longer you looked, the more you saw, and people who spoke started with a big picture and zoomed in. Some people might have started with the details and then zoomed out, but it also makes, I think, you aware of how you are thinking about it, and how you're approaching the task. Anybody else? Any comments about what the facilitator does to support the process, or how this might be relevant to teaching about flourishing or flourishing?
My first thought about the process and what you were doing to facilitate was that it felt very non-competitive. Very often in medical education, it was almost as though we could stand around a bed with every student trying to figure out how we're going to diagnose this patient. And yes, we're all sort of throwing out ideas, but very often in that environment, it's a who can say what's right? And there was no right. There was just a collection of, again, perspectives. And so it added to the breadth without there being a sense of, I'm gonna say something better than you said, which expands our ability to be open and educated.
Yes. So you made a couple of points there. One, you're kind of drawing a parallel to looking at this object to the clinical situation of where we might be gathered around a patient, considering what's going on with the patient, trying to understand them, and you're noticing that you noticed that there was sort of not a competition, and I would just say that I did try to remain neutral. I mean, that's one of the tenets, to remain neutral, to not get really excited about one idea, not excited about another. Try to paraphrase without judgment, and use conditional language. This could be for you, this looks like, this may be, to keep the conversation open so that a divergent view could come in, as it happened, a couple of times, divergent views that are, and they're linked, but they're held kind of equal measure as right. I do think it does empower people to speak up. It helps, without this, it helps level the hierarchy sometimes, to have people be able to have it kind of be on equal footing in a conversation. Nobody's expertise really trumps somebody else's.
Well, then how often do we find that in a classroom setting? That maybe the faculty member is waiting until someone in the class comes up with the right answer. Well, then if you have somebody in the classroom who consistently is sort of that person who comes up with the right answer, then it really shuts down other people and their thoughts, and it creates a culture, again, that is not as open.
Right. And there could have been somebody here that was an expert in this painting, and there are certain paintings I've used where people have had some expertise, but again, the way I would have handled that would have been, okay, so for you, this is that. I wouldn't have put that on top of the, the top of the class, okay? Well, I'm going to move on so that we can get to some of this is the evidence. I think we've talked about some of this, or it's kind of been obvious that it required close observation. We had to reason with evidence. There were a couple of times where I'd ask, what do you see that makes you say that? If there wasn't clear evidence provided, like, the being reflective or something like that. As was mentioned, you had to evaluate and revise your ideas. There was communication skills involved. You had to put yourself in that picture, imagine what it was like, what that person might be reflecting on, maybe bring some of your own experiences in that could perhaps be biases, but might be relevant. We talked about appreciation of multiple perspectives. You had to be open to the unfamiliar. Not only is this an unfamiliar task, it was an unfamiliar art piece, I hope for most people. And we had to tolerate ambiguity. There were multiple possible narratives. I'm not telling you what it's about. And I don't think the artist really wants to tell you what it's about either. This, just as an anecdote, I always say this to our students, and that their idea is just as important as the idea that's on the plaque, even if that idea comes from the artist. And we were once at the Baltimore Museum, and student was about to talk about a painting, and she didn't know the artist was there, but the artist was there, and the artist ran up to her and said, "Have you read about it? Did you read the plaque?" And the student said no, and she goes, "Oh, good, because I want to hear what you think it's about and what it means to you." So even if the artist had an intention, they wouldn't have used an ambiguous medium like this to communicate if they didn't want you to have your own ideas and make your own connections. And then it was mentioned about perseverance. Okay, so I'm going to shift a little bit to talk about what we do at Hopkins. I am the director of this program. Our mission is really an educational one, and we try to integrate the knowledge based on flourishing, human flourishing, the scientific knowledge. We try to bring that to our clinical learners. We use this flourishing model from Harvard as a framework for our museum-based programs. This describes 5 domains of flourishing that are on the right, and then the 4 pathways that are causally linked to these domains. So Tyler Vanderweel, we'll talk more about this tomorrow, but Tyler Vanderweel came up with these based on the literature around flourishing, these 5 universally desired goods that are ends in themselves: happiness and life satisfaction, physical, mental health, meaning and purpose, character and virtue, and close social relationships. Now, there's another big model of flourishing out there, the PERMA model, that was developed at Penn by Martin Seligman, that doesn't take into account mental health, and it doesn't take into account character and virtue. But I think we can all agree that you can't be flourishing if you're not a good person. So I think that's an important addition to the field. And so Tyler Vanderweel is a statistician who studies, who uses his area of expertise is drawing causal inferences, causal links from large epidemiologic data sets. These are studies that have been conducted over decades, sometimes 50 plus years. And so he looked at those studies, and he looked at the people who were happy and had health and had meaning and purpose, and then he went back and asked, what factors were common to lead to those outcomes. And each one of those lines is a connection, and each one of the little numbers above the line is a study that supported the connection. So he found these 4 pathways to flourishing. That's not saying that they're exhaustive. There could be other pathways, but these were the most common. And those domains of flourishing doesn't mean that if you don't have one of those domains, you can't flourish. There are plenty of people who have mental health problems, for instance, that are able to flourish even when they still have acute symptoms. There's a study that was done, and I think published in around 2017, It showed that people who had schizophrenia and were still hallucinating, still delusional, even though they had no symptomatic recovery and no functional recovery, they were able, 25% of them, to have meaning and purpose in their life and feel like their life was worth living. So I'm going to just really briefly, so that we have some time for Q&A, talk about how we've used specifically VTS for the character and virtue, to support character and the virtue domain of flourishing. We use this framework for character education that was developed at the University of Birmingham. I think I'm going to talk more about this tomorrow, so maybe I won't go into this right now, but it basically divides categorizes the virtues into 4 types: intellectual, moral, civic, and performance. And then there's discernment of right action that requires the development of those virtues, as well as practical wisdom, kind of meta virtue, or one of the cardinal virtues, and then that leads to flourishing. And so examples of intellectual virtues: curiosity, close observation, critical thinking. There are studies that support the use of the arts to develop these skills, as we experience today, the observation skills. I'm not going to go into detail about these, but there are several studies. Critical and creative thinking, and tolerance for ambiguity. This is something that's really associated with low tolerance for ambiguity, is associated with really poor outcomes for providers as well as for patients. The moral virtues: empathy, open-mindedness, humility, integrity, can all be taught using the arts. There's evidence for arts-based methods to develop empathy. The civic virtues: community awareness, for example, perspective taking, civility, service. Art can generate psychologically safe environments to challenge assumptions, to talk about difficult topics. Performance virtues: perseverance, teamwork, motivation, resilience. Examples of that are used in the art been used to process clinical experiences. And then, importantly, there's plenty of evidence to suggest that arts engagement can enhance joy, spark renewal and engagement, enhance wellness and resiliency across learners and educators alike. And these studies are growing. There's more of them. We wrote a review about how they can scaffold this learning around the virtues. I want to move now to talk about the 4-week course that we run for medical students. We began piloting this at the Baltimore Museum of Art in September 2019. We wrote papers on all these that you can find in the literature. Out of necessity during the pandemic, we adapted the piloted sessions to be part of a 1-week online course. And then when the museum started to reopen in January 2022, we were able to offer this 4-week course in the museum as it was intended. I won't go into detail on the objectives, but they do include objectives related to the flourishing pathways. The course is actually arranged around the flourishing pathways. We've brought in community from religious, because we're not a religious school, to community more generally. But we have the first week focused on family, second week on community, third week on education and work, which for the students is more or less the same, and the fourth week is self-care. We've renamed that flourishing because the students didn't like self-care. It sounded like there was too much burden on them to make things better rather than changing the system. The course takes place over 4 weeks. As I said, each week is guided by a theme related to flourishing. Each session is 3 hours. The initial offering of the course we had as a hybrid. We had 5 online, 12 in-person in the museum sessions. That was because when we offered the online course and we asked people at the end if they wanted this to be hybrid in the future or all in person, they said hybrid. Of course, when we offered it as a hybrid and we asked people what could be done to improve the course, they said to get rid of the online sessions. So So we begin each session with a check-in. We briefly discuss how the participants are feeling. We usually begin with a visual thinking strategies discussion, and we select a variety of artworks in a variety of settings, like the Baltimore Museum of Art here. We also go to other Baltimore and DC museums. We use projected images. The Homewood Museum's a historic house on the Hopkins campus in which enslaved people lived, and we lead a discussion of this painting in a classroom in the basement of the home. We also lead VTS discussions in the hospital. This is the Children's Center. We go to the medical archives. We go to the community and have discussions of mural or street art. And then we also lead non-visual thinking strategies activities. There's an activity called the Personal Responses Tour. We do back-to-back sketching. We go out into nature and do forest bathing. We have mask making. And after VTS and the other whatever unique activity for the day is, we always then have a written reflection to an ambiguous prompt. Like during the family week, one of our prompts is write about a family member you've never met. And then we conclude each session with a live reading of a poem or a playing of a recorded song. We've evaluated the courses. I'm not going to go into a lot of detail about this, but we use quantitative and qualitative measures. I do want to highlight two really important outcomes of our course. So we know what the means are for capacity for wonder, tolerance for ambiguity, interpersonal reactivity index, which is a measure of empathy and openness to diversity. We know what the means are for those for the Hopkins students on capacity for wonder, and we know what the means are for 10,000 medical students for the others, because they're part of a questionnaire that all medical students get. Our students came in below the mean on every one of these measures. After the course, they were above the mean, they were either at the mean or above the mean on all the measures. And those capacity for wonder and tolerance for ambiguity, those were statistically significant increases. And I won't go into the details of the qualitative measures, but we analyzed their reflections. They also had a structured interview with somebody not involved in the course after the grades went in to talk about what the impact of the course was for them. This is what they said: art to connect with others, art to connect with oneself, time to be free from distractions, and art to foster their professional identity formation. I'm not going to go into all that because I want to have time for your questions. So please ask away. Thank you. That was speedy, I know.
What questions do we have for Dr. Chisolm in terms of follow-up or something you thought about?